Now, Dr. Dipankar, the researcher ophthalmic researcher of Assam, in the purest sense of the term, and um, would like to learn a topic which is also new for me, doing cornea for such a long time, using green laser in fungal ocular infections. Dipankar, it's all yours.
Thank you, sir, for this generous introduction. I'd like to thank APAO, AIOS, and Dr. Namrata Sharma, Chairman Scientific Committee of AIOS, and OSA for giving this opportunity to present my topic on use of green laser in ocular fungal infection. Myself and the co-author who were involved did not have any financial or commercial interest in any of those material discussed here. This is purely an academic one. Now, this is a well known for all of us when you see a dry looking corneal ulcer. The next point is that we do a scraping and send the specimen for KOH. What we innovated is that to do a fluorescent stain, and here you see those are the drug particles. After removing the drug particle and put a fluorescein, the fluorescein that is solution fluorescein, then the fungus were visible. And this we published in Indian Journal of Ophthalmology as a fungal corneal ulcer stained with fluorescein stain. Now again you see this is again a dry looking ulcer. Now scraping was done. It shows a septate fungus. Now the therapeutic keratoplasty was done. Then it was cultured, and this in the middle you see fluorescein stain with all conidia of Carbuleria. And this was further done in the right side picture with a lactophenol cotton blue sweat in microbiology department, who showed a conidia fungus. Third scenario is that this is a uveal specimen of eviscerated specimen showing uveal tissue, cornea with PK suture, IOL, and vitreous. And when we did a fluorescein stain, we saw fungus on the IOL and the fungus in the vitreous. This in 2020, we published a fluorescein dye as a novel cost-effective approach for staining raw specimen in ophthalmic pathology. And these were compared with the conventional Groker-Smith-Norman silver staining. Can we visualize microorganism without a stain? That's a big question that we ask ourselves. There are various uses of laser in ophthalmology. Currently, microbiological staining in laboratory are the diagnostic modalities for detecting microbes. The objective of the study was to analyze the effect of laser in different fungus for their detection. Now, see, the pointer class 3 laser product was used, complied with 21 CFR wavelength of 532, were used in laboratory setup, and objective of compound microscope JEISS Exoscope 40 made in Germany, and without taking any microorganism. Important thing is that to protect our eyes, there's a shutter is there so that rays does not come, and necessary eye protective measures were taken. Raw specimens were studied. They were examined in the monitor of computer attached to the microscope and photographed in the Exoscam MRC camera. These are the clinical picture. These are the eyes that came to the cornea department, but I have collaborated with them, and see these all are in my cameras that I have documented them with a solution fluorescein stain. When you use a strip, you do not get the depth of the thing. So this is one point you can use with a fresh solution that you can get from angiographic room. Now, 2 years, total 15 cases of mycotic corneal ulcer were studied, 5 cases of aspergillus, 4 cases of fusarium, 4 cases of carbulia, penicillium in 2 cases with green laser. Results were compared with conventional staining. Now we see in this clinical picture, KOH was done immediately in the scraping, and in our lab we have done fluorescein stain in those cases, and GMS stain, if you see, was done in the permanent section. All this green laser was seen in our microscope. To discuss it, label-free fluorescence is based on autofluorescence originating from endogenous fluoropores. And nonlinear microscopy has a capacity to linking a structural information of the fungus, particularly the chitin layer of the fungus. Spatial image can be acquired from point to point as in our study, and fungus can be seen in fluorescent microscopy by using a chalcophore white stain. But you require a fluorescent microscopy, and I have done this in a compound microscopy. Our study showed alternative way of conventional light microscopy to detect the septate fungus. Limitation of the study was sample size was small, and further studies are larger scale are required in that vein. Now we see two photographs where the fluorescent stain, our innovative fluorescent stain, showed the conidia, phthalates, vesicles, types, and you see the right-hand side picture, green laser in the present study, or phthalates are so nicely picked up by the laser. Again, you see the carbolidea where the fluorescent stain already published showing the conidia, and right-hand side green laser was used to pick up the fungus. To conclude, the stainless laser and its modification was effective in diagnosing the fungus in vitro in corneal ulcer. In future, the use of properties of light, we can translate this innovation in real-time live patient fungus detection. These are my selected reference, and I like to quote that process of innovation are after a lot of basic experimental stages and scientific imagination. I like to thank cornea department, SSD and ocular pathology, and microbiology department. Thank you for patient hearing.
Thank you so much, Dipankar. Just stay here. By the time Kasturi prepares for her talk. So Dipankar has given a really a big potential that one day we might be seeing fungus live in corneal ulcers. And let that day be coming very soon. Otherwise, I will be not having that opportunity. Jantada will not have that opportunity. Let that time come very soon, and I request Dr. Dipankar to work very fast so that we can see that in our life.
Thank you, sir. Thank you.